Hi everyone, I'm Catherine Maji from the SG2 Intelligence team. I'm excited to share a preview of a research project that we have been working on. And the working title is Quality's Place in Health System Sustainability. For this work, we have the privilege of collaborating with Jodi Eisenberg, who leads the Vizient Chief Quality Officers Network. She's joining me today for this conversation. So Jodi, welcome. Would you please introduce yourself to our audience?
Hi, Catherine. Thank you so much. It is great to be here. I'm Jodi Eisenberg. I'm an Associate Vice President at Vizient. I lead national networks, including quality executives and accreditation leaders. Over the years, I've held quality and accreditation leadership roles, both in academic medical centers, community-based health organizations, and other manufacturing jobs. So I'm really excited to be here and be part of this.
So quality has always been considered table stakes in healthcare. But would you say it is more important than ever right now? And why is it becoming harder for organizations to sustain?
Absolutely more important than ever, in my opinion. Quality has it's always been a strategic asset. It's always been driving performance of healthcare organizations. I do believe in our current environment, especially with tight margins, competition, increased patient expectations around the care they're going to receive and when they're going to receive it. I think quality has the potential and is the potential for differentiating organizations.
Absolutely. In fact, we recently analyzed Vizient's clinical database data and found that top quality performers not only deliver better outcomes, they also have lower direct costs as well as higher commercials to Medicare payment ratio compared to their low and average performing peers. It is a strong indicator that quality is directly tied to hospital systems business sustainability. Now, of course, every single organization's approach quality differently. As part of this research, we also grouped organizations into four different archetypes. And let's take a closer look at one of them and what we call quality as identity. So, Jodi, from your perspective, what defines organization in these categories and what sets them apart?
Sure. So when we talk about quality as identity, those systems are the systems where quality doesn't just reside in a department. It's integrated into their DNA as an organization. It's part of their everyday culture. It comes out when they make decisions. You see it in the process they use for decision making. You also see it in how they allocate resources. And it is part of every leader's composition. It's how they lead every day at every level. They talk about success. They also talk about that underlying focus on the mission, the visions, the values that brings quality to the forefront. And I think too, because that's the way they are working, it embeds itself in their governance, in their strategy, and in their culture.
Now, Jodi, I would like to share a couple of our key themes from the research work that we have done so far, and I would love to get your thoughts. The first one is a quality first approach is foundational for building a successful system of care. And this is especially critical with all the challenges that we're facing in healthcare, and you name a few already just now. And number two, accountability is coming for ambulatory quality. And would you like to share your thoughts about these two key themes that we have?
Absolutely, Catherine. So let's take the first. So high performing systems recognize that quality isn't just an outcome, it's a capability. And in fact, we have data that supports those organizations that focus in this manner do have higher outcomes. They also have better costs associated with those outcomes. To be successful, I think they invest in structures and people to support every site of care, every part of their organization. This allows them to really meet the needs of the patients. And this focus on quality at every turn helps them to build patient trust. It strengthens payer and community partnerships. It supports their team and then ultimately their organizational growth. And I think quality is really what enables access and capacity. It's how systems safely expand their footprint and they grow. Without that focus, I think that the growth can actually dilute their performance. And then when you think about ambulatory, accountability in the ambulatory site, what we used to call ambulatory was a little bit easier to define. Now, when we think about anything outside of acute care, it's the wild, wild west. And I feel like we're at an inflection point. Quality links to identity in my mind. And I talked about that one archetype. Um, Quality isn't just a set of measures, it's trust, it's safety, it's performance. It's very, very important to remember that behind every number, every rate, every percentage, it's a patient and likely their family. And so the work that you're doing, regardless of where you're doing it within the organization, is impacting someone and could ultimately impact you. So when I think about the work that we're doing, the invitation is pretty simple. Ensure that quality is at the core of the system strategy. And I believe that when systems lead with quality, everything else follows.
And this is the reason why this body of work that we're doing is so important because quality has to be embedded directly into the decision makings that we do every single day in healthcare. So thank you so much, Jodi, and thank you everyone for joining us. Our quality publications will be released by end of the year, this year, so please stay tuned. Until next time.